Welcome to the Intuitive Health Podcast. I'm your host, Dr. Anthony Rafferty, medical doctor, PhD, Reiki, and shamanic intuitive healer. I'm here to bring you on a journey of holistic healing that explores the science of the physical body combined with mental and emotional well-being, energetic and spiritual health. And I am so excited to welcome Eilish here onto the podcast today. Thank you so much for joining us, Eilish.
You're very welcome. I am delighted to be here, really delighted to be talking about this, getting this information out there. And thanks so much for having me.
Oh, I love it. I love it. Like, I'm on a journey at the moment connecting with people working in the natural or restorative reproductive medicine field, just to be able to empower all these lovely individuals and couples on this journey of fertility, or even just optimizing their reproductive health and their hormonal health, how they can go about doing that, and, you know, giving them some good, positive direction to move in. It can be so confusing in the world of reproductive health with regard to the information that's out there. So it's such a pleasure to have you here, Eilish. So just a bit of background. Eilish is a fertility advisor in restorative reproductive medicine, and she works with individuals and couples that are on a journey of looking at how to optimize their reproductive health. And I was so keen to talk to Eilish today because she's helped so many people achieve pregnancy success, but also optimize their reproductive health for the long term, you know, for their life, by getting them to tune in to the body and how to optimize their cycles. So I would love to hear a little bit about kind of cycle tracking, Eilish, and the importance of getting to know your cycle.
Oh, absolutely. I'm more than happy to share this information. So when we are, starting to menstruate, we're just told to focus on the period, okay? Because that is the most significant thing that you see. However, if you only track menstruation, you are missing so much. So you're going to miss things like when your follicle is beginning to develop. So we're able to identify that when you start observing mucus. We're missing, say, the LH surge. And this is a really key one because the amount of days that your surge is happening over indicates specific things also. And then we would also miss your luteal phase length. So the amount of time that you're getting exposure to progesterone, which is so important because that impacts your nervous system, your mood, and so much more. So your ovarian hormones that we can track, they impact us on such a greater level than just for menstruating. They impact the whole body. So it's so important that we actually understand how to track the cycle fully and not just kind of have in a period tracker app, okay, this is day one of my cycle. I was bleeding for 5 days and that's all I'm going to tell that information. We're missing all of that, all the rest of that if we just skip everything else.
Yeah. And I love this because even, you know, I do get contacted regularly by women that I've recommended to have their day 3 hormonal profiles done. That's the day that I love doing everything to look at the baseline hormone levels. But it's interesting because even the awareness of when day 3 in the cycle actually is, you know. So let's talk a little bit about the different phases of the menstrual cycle. When does the menstrual cycle actually start?
Okay, that's a great question. And you know what? It's a starting point. So the day that is day 1 is the first day of full flow. So any premenstrual spotting that only requires a panty liner or is only there when you use the bathroom, that is not day 1. Day 1 is the first day that you would require a sanitary product. So it's a sensation that you can't miss. It's like it is a really obvious sensation. That is day 1. We would then count. So you can have your day 3 bloods obviously between days 2 and 5. So, but from that first day, anchoring that to get those bloods done. Anything premenstrually. So if you're seeing spotting for a day or multiple days prior to that full day of first flow, again, that's indicative of something. So being aware of the difference is crucial. So that was a perfectly, fair question to ask.
Yeah. And like, do you tend to have a cutoff during the day? Like a time point that if you start bleeding and you have full flow at like 12 o'clock or 2 o'clock versus 7 o'clock at night?
No, and there's differences between the methods, but no, to answer your question, we don't. So we wouldn't ignore. So say a bleed started, so say spotting started at, I don't know, 12 o'clock until 4, and then the full flow began at 4. That's still the first day of menstruation. Whereas if the spotting began the day before, and then the full flow was the day after, the full flow is the one, whatever time it starts at.
Yeah.
We don't rule out half a day of say, menstruating.
And so if you're seeing, I love that you're kind of touching on this kind of several days of spotting, and some women are getting brown bleeding before. What do you tend to advise during those times? Because with the spotting that's leading up to the bleed, what's normal and not normal?
Yeah, so I don't really like to see anything more than a day of spotting.
Yeah.
And then if we're going into 2 to 3 days of spotting, straight away my mind is going to low progesterone.
Mm.
We'd I would definitely be looking towards getting some blood tests in the luteal phase, which we can discuss a little bit later, just
Yeah.
to tie in progesterone and estrogen in that luteal phase to ensure they're optimal. But when there is spotting, pink or brown, it can indicate low progesterone if there's 2 to 3 days or more.
Okay, I love that. This is really great information for people. And so, what does it look like when the bleed actually starts? Let's say you're getting your full flow that's coming on. How many days should that typically last?
So between 3 to 7 days, but then we'll dive in a little bit deeper. I don't want to just know that you're bleeding for those amount of days. I want to know kind of how much you're bleeding,
Mm.
because blood loss, you know yourself, if there's too much as well, that can indicate other issues and maybe warrant further testing for maybe your iron or your ferritin. Um, so let's say a normal healthy bleed would be changing probably 3 regular size pads or tampons. Now, people use cups and period underwear as well. So just being mindful of their different methods that they will use to change for during menstruation. But if we're talking about regular size pads, probably 3 pads are almost full a day for maybe 3 days, and then 2 days of spotting. So whereas if a woman is soaking through her sanitary wear, having to double up, having to get up in the middle of the night to change her jammies and her bed sheets, this is not normal at all. And as a teen, I know I experienced that. And I think this is where my fire comes from for this work. For so long, I'd be getting up and having to change my bed sheets, and I was just told, "Oh, it's just your period. It's grand." Like, had no idea that it actually indicated a hormonal imbalance.
Mm. And this is so important, and I love that you're speaking into this and giving people an idea of what's normal and not normal, because I had this lovely lady in yesterday and I was like, oh, she is in her late 40s now. She was started on the pill immediately upon getting her first bleed because it was so heavy and painful at that time. She she went to the GP and they popped her onto the pill. She's been on hormonal contraception her whole life. She transitioned into the coil in her 40s. So when I was asking her about her menstrual cycle and what it was like, she's like, I actually have no idea what my normal menstrual cycle is like, because from the very outset it was horrendously heavy, very, very painful, and I immediately started birth control. So it's just
Yeah.
wild, isn't it? Like this kind of journey with pain and heavy bleeding, and knowing what's heavy versus what's normal.
Mhm. Mm.
Yeah,
Unfortunately, that's the narrative for so many. I can relate to that story myself. Not obviously not throughout my whole adult life, but as a teen. But I think kind of honing in on the fact that when the periods are beginning in younger girls, so in teens, let's say, the brain and the ovary are only starting to connect. Okay, so let's imagine you're new at a job. You're going to need a little bit of time to get good at it. So the brain and the ovary are just starting out their journey on this job together. And initially, the ovulatory event isn't optimal. We don't have enough progesterone. The bleeds are heavy. Yes, there can be pain. But the thing to really understand is it's just because the communication between the brain and the ovary is only beginning. And if you kind of take away the opportunity to allow those cycles to become regular by just suppressing it with the pill, that's doing a disservice to women, because not only do hormones being secreted by your ovaries, yes, they're important for fertility, okay, no doubt about that, but they're important for your whole body, for everything. Like I said earlier, they impact your blood sugar, their bone formation, your mood, so, and I think also given that medication without giving that information, it's not fair to do to women.
Yeah, I totally agree. And I had this beautiful lady in her early 20s in with me a couple of weeks
Mm.
ago. And she was getting such heavy bleeding in her late teens. She was put on back to back pills. So she actually hasn't had any bleed for many, many years. But it was never investigated. And actually, she came through to me. Her CRP, which is a marker of inflammation, was through the roof. Her body is in a state of complete inflammation, like systemically, the whole body inflammation. And sending her even for pelvic ultrasound, it looks, even on the ultrasound, we're seeing that there's evidence of significant endometriosis. And
Wow.
people don't realize that actually it's so important to identify and manage these things and intervene early, because things like endometriosis, it can ravage the system. It can have such an impact, causing adhesions, so many issues that then impact later fertility. So if there's any young women listening to this, and their ears are pricking up here thinking, oh my God, what has been happening here? I encourage you, even if you don't know that you want to have a baby now, it could be something down the line. Make sure that you're investigating and managing all of these things from an early age. And I love, Eilish, that you're speaking into this, so people can kind of be like, oh, actually, maybe what's happening for me and has been from day one isn't normal.
Yeah, yeah,
Like, so powerful.
absolutely. I just think it's really important. Even for me as a teen, I actually didn't understand how the pill worked, and I just thought I was having regular periods. I genuinely thought, oh, the pill has regulated my bleed. That means I have regular periods. I had no idea that my ovaries were essentially quietened and my own hormones that positively impact my whole body were suppressed. I think giving that information to women is
Yeah.
so important as well.
Well, it's so interesting. I love that you've brought this up, because actually, a lot of women don't realize that when they bleed because they've come off their packet of the pill, that's actually withdrawal bleed. It's not
Yeah.
truly an actual menstrual bleed like you would get with a regular cycle. And is that something that you find is common? People unaware that that's the case?
All the time, like all the time. So I would have calls and I'd say, okay, so tell me a little bit about your history. And they'll say, well, I had regular bleeds when I was on the pill from regular periods when I was on the pill from X to Y. And I'd be saying, okay, so you're menstruating. You weren't actually menstruating on the pill. That is a withdrawal bleed. Menstruation is followed by an ovulatory event, which is suppressed while you're on the pill. And it's like,
Yeah.
that's literally the reaction. They're like, what? It's
Yes.
not even an awareness that ovulation is suppressed. It's just, this is regulating my periods, you know?
Yes. Oh, I love this. Well, let's move on then from the menstrual cycle, the menstrual period when you're actually
Mhm.
bleeding,
Yeah.
into the end of the bleed.
Yeah.
And then when the hormones start to kind of ramp up. Tell us what's kind of happening and what you might see at the tail end of a bleed that may or may not be normal.
Yeah, so again, during the end of your menstrual period, depending on the length of your cycle. So if we have somebody that has a really, really short cycle, let's say we're saying 21 days here, we can actually see the follicle kick off early, as in, it's being stimulated by a hormone called follicle stimulating hormone, and it's starting out on its journey to grow at the end of menstruation. And we can see an early ovulatory event around day 10 or something like that, depending on how long it takes it to develop. That'll be in a really short cycle. In, let's say, a more regular length cycle, we'll just pick 28 days. We'll typically start to see the follicle developing around day 10. So we can actually observe that by allowing the woman to track her cervical mucus. And the reason we can observe when the follicle begins its journey to rapid maturation is because the follicle is being stimulated to grow. within the follicle that's growing, there are cells that produce the hormone estrogen. So when estrogen is being secreted into the bloodstream, it's a chemical messenger. It goes to the cervix and it basically says, hey, I need you to produce mucus. The cervix then starts to produce mucus as a result of that follicle growing. So that's how we know the follicle has started to mature. Now, as the estrogen rises and the follicle gets bigger in its journey towards ovulation, the the mucus characteristics change. So initially the mucus might be quite gummy, it might be white or cream in color, and it'll be quite tacky. As the estrogen becomes more abundant in the bloodstream, the mucus characteristics change, because when the estrogen is at higher levels, it stimulates different crypts in the cervix to produce a different type of mucus. So really close to ovulation, we might see clear, slippery, stretchy mucus, or just a wet or slippery sensation. So observing that change in mucus over a number of days is how we kind of follow the follicle, if you like.
Oh, I love that. So this is really important. For all these gorgeous listeners, listen to this. So as you come out of your bleed, you start to get the production of FSH, or follicle stimulating hormone, which then stimulates the ovary to produce the follicles. So I was speaking into this in a previous episode, that you actually get multiple follicles start to develop, and then one of them becomes the queen, and she's like, hey, like, I want to be dominant here, you know? And so with the growth of these follicles, it's like the feedback mechanism you're talking about. You're getting estrogen production. Now, and I always, I love talking to women about what estrogen does. It's such a beautiful hormone in the body. People feel fantastic. So during that follicular phase, as the follicle develops on the journey, people are starting to feel better. And the closer that they get to ovulation, they're obviously starting to feel, they're feeling themselves. They're feeling good, you know?
Yeah.
And in and around then ovulation, obviously, you're going to get some testosterone production, which actually makes them feel even better again, you know? So for ladies on a journey with menopause or perimenopausal times, you're getting reduction in this estrogen production. The type of estrogen that produced by the body changes, and you know, that's why women are kind of don't have as much energy and they're not feeling as fantastic. So that's something I see quite a lot, depending on who's coming through the door. So as you're kind of coming up on this ovulation time, I love that you're speaking into the mucosal changes, because as I speak to some of the women when they come through, I'm like, do you know when you ovulate? And they're like, well, I kind of have an idea. Can you talk about ovulation pain? Can you speak a little bit more into the specifics, like you were saying, of what you might see? How stretchy does the mucus become? That sort of stuff in and around the ovulation.
Yeah, so really close to ovulation, it's really important to remember that every woman is unique, okay? And one woman's mucus may not look the exact same as another, but just close to ovulation, we look for a mucus that is called peak type, okay? And peak mucus has either clear, slippery, or stretchy characteristics. Now, it only has to have one of those, okay? Or you might just feel a really wet or slippery sensation. A sensation is really, really key, especially if I'm teaching somebody with an absent visible mucus observation. I focus so much on that sensation. So in the day when you're walking around, when the fertile window opens and close to ovulation, there's obvious changes. And when we bring in those techniques to not miss the sensation, we start to notice, okay, there is mucus there is a sensation there. But to answer your question, the stretchiness can go really, really long, or it could just be like, it can be short. But once it has either clear or slipperiness, or it's stretchy, that is a peak type mucus. So not focusing too much on, I think a lot of people get really kind of focused on having this abundant raw egg white type of mucus. But in reality, not every woman sees that. And that doesn't indicate anything. As long as you're having a mucus pattern over approximately 5 to 6 days that is changing. And we're seeing the nice LH surge, and then we get those bloods done at peak +7. We get those hormones tested. We don't just kind of focus on one thing. It's so important to bring it's like a piece to a puzzle.
Yeah. And so just before we speak into what LH is and what a peak +7 blood is it possible to kind of just clarify, are women using their fingers to stretch the mucus? What's the best way to kind of do this for women to assess this themselves?
Yeah, of course.
Yeah.
So, firstly, throughout the day, my advice would be mindful when you're walking. Is there a sensation of slipperiness or wetness? When you're using the bathroom, wipe before and after you go. Be mindful of the sensation. Does it feel slippery or not? Then visually look at your tissue. If there's something to take off that tissue, so mucus will come off the tissue, it will lift off, and it will either stretch. So let's say you try to stretch it and it just bounces back to the finger or the thumb. That means it doesn't have a stretch. Whereas if you stretch it, you literally take it off, become familiar with your secretions, and open those fingers and see if it stretches. If it's a short stretch, it will be quite small, and then a long stretch will be anything over, say, 2 centimeters. But yes,
Amazing. That's
do take it
amazing.
off the tissue.
I love that. I love that. And so it's just because some people, when they come through, they're like, I'm not sure how to do that or what that looks like.
Yeah.
So I think you're given such amazing, just very clear tools to be able to really start tuning into the menstrual cycle.
Mm-hmm.
And to just kind of highlight, that I think we've been told through standard kind of medical education and practices, for a standard 28-day cycle, ovulation occurs on day 14. That's what we're told in medical school. That's what everybody's told. But actually,
Yeah.
what we see in clinical practice, that's very, very different for a lot of people.
Mm.
And, a lot of the women that I work with, they're like, oh, I'm not sure if I get mucosal changes or cervical changes in my mucus, but I think that some of the stuff happens. I'm not quite sure when ovulation is occurring. And when we do follicle tracking on ultrasound, actually, when they're ovulating is a very different time to what they think,
Yeah.
know?
Absolutely. I have
Yeah.
exactly the same experience as you. Like a 28-day cycle, I might see ovulation occurring on day 19, and we know then you're like really at the lower end of that luteal phase, as
Yeah.
opposed to if you're ovulating on day 14, you've got a nice luteal phase length if you've a
Yeah.
28-day cycle.
Yes. And so just speaking into the duration, we kind of talked a little bit about the duration of the bleed. And do you tend to see that the duration of the follicular phase
Yeah.
changes at all?
Yeah, I mean, it depends. Again, so your follicular phase is the most variable phase of your cycle. So if there's anything kind of impairing ovulation, it will obviously happen in the follicular phase. So I work with everybody I work with realistically has an irregularity in their cycle. So we might start to see the follicle developing a little bit later. And that's what I tend to see most is the follicle is not beginning its development until the late teens, meaning the ovulation isn't occurring until say day 22, which is showing us that the follicle is struggling. Why isn't
Mm,
it developing around day 10? What's impairing it?
yeah. Yeah. I
There's
love
all the
that.
questions we need to kind of dig our teeth into, and then get some bloods done to like assess it, find the problem, and then restore healthy parameters. That's the objective.
I love that. And so when we're entering into the ovulation window or the fertile window that you spoke about, how
Mm.
long does that last? And does it start before you ovulate? And is it always does it if things are going well, is it always associated with those mucosal changes?
Well, a really important consideration that not many people seem to know is that mucus actually keeps sperm alive. So if you're trying to conceive, okay, there needs to be mucus there because the pH of the vagina is too acidic without mucus, so sperm cannot survive. So we need mucus firstly for that. And then the fertile window is prolonged just past kind of the ovulatory event because of the fact that cervical mucus can keep sperm alive for between 3 to 5 days, or in some extremely optimal conditions, research found up to 7 days. But um, let's say you start observing mucus on day 10 until day 14. And then, we confirm ovulation. Your fertile window is the time you have mucus until peak day, which is the approximate day of ovulation plus a count of 3. That's the time that we would consider you fertile within that cycle.
Oh, I love that. Okay, so you're fertile for up to 3 days essentially after you've ovulated.
Yeah, well, most women ovulate on peak day or day either side, but it was found that it can go up to peak plus 3. So we have to allow that for every
Mm.
woman, unless we're like follicle tracking scan at the exact moment to
Yes.
confirm ovulation, because
Yeah.
obviously if the egg, we don't know exactly when the egg is released, so we have to allow that.
Yeah.
You know.
I love that. And so when people are having intercourse, when's the best days to do it during the fertile window?
So first of all, one of the most important things I say is that you want to enjoy the fertile window. You don't want to make it sort of any sort of
Mm.
military style robust thing. This is supposed to be like a loving connection.
Mm.
So genuinely, and for women, you feel your libido increases. So just follow your body. Now, getting more technical, I suppose, depending on the semen analysis, if everything's absolutely fine, you can have it more frequently. Whereas if there's any kind of parameters that need support and there's support being implemented, we'd say like every second day to essentially like give the sperm a chance to, regenerate, if you like. So not using every single day, but any day of mucus and maybe the day after peak day as well.
I love that. I love that. And now, so we see a lot of women coming through the practice that they use different methods to identify when they've ovulated. So sometimes we see the ovulation sticks. People are using basal body temperature. What can you speak into kind of the different methods of determining when ovulation has occurred, whether they're accurate, first of all, and what do you find works the best?
Well, for me, okay, I want you to like imagine the foundation of fertility charting is your cervical mucus. Like, I cannot stress that enough. Every other biomarker is like what comes in line after it. LH is a lovely biomarker as well. It is, I do like it, but it can throw people off, especially in PCOS. In PCOS, there's less exposure to progesterone throughout the whole year, if you like, because there's less cycles, allowing that LH to run wild. So it can be really confusing. Whereas when you're tracking your mucus, and combining it with LH and temperature, you get a far more accurate reading.
Yeah.
Like combining those three together, I have found is the best way to truly identify the fertile window and confirm ovulation.
Lovely. And so for those listening, LH is luteinizing hormone that's released from a little gland in the brain, and it goes down and stimulates the follicle to release its egg. So it's basically it's used in some of these strips or these tests that people pee onto sticks and things like that, to be able to determine when there's a surge in that hormone, because it occurs at a very specific time in order to trigger the follicle to release the egg. So obviously, like, I love using my ultrasound, like my sonographer Trish, just phenomenal at doing fertility follicle tracking, so we can see when the follicle's on its journey to release the egg. But if people don't have access to that, you're suggesting it's okay to use the LH strips, tracking your cervical mucus, which is really important, and also what happens with the temperature.
Yeah, absolutely. So definitely using that LH test strip. And just, I suppose, an important one is we like to see the LH surge around the time that there's mucus, because keeping in mind the peak estrogen that gives us that peak type mucus also then is the feedback to the brain to release that LH, like you mentioned. Then when we get the LH and the follicle ruptures, we get the new gland called the corpus luteum that gives us that progesterone. Now, progesterone is produced after ovulation, well, a little bit during and after ovulation. And what happens is it has a thermogenic effect on the body. So it heats things up in the body and it increases your temperature at rest, so your basal body temperature. So the first thing when you wake, what we would advise is if you're using a basal body thermometer, take your temperature at the exact same time every morning when you wake. So it has to be the same time. So say you set an alarm for 8 a.m. and after you ovulate, your temperature rises and it stays elevated above all of the follicular phase temperatures.
Mm.
And this confirms ovulation for us as well. It's a gorgeous visual biomarker, really, really nice one to, especially when somebody's only learning their mucus, it's really, really important to have that in there.
Oh, I love that. Oh, another amazing little tool to help women identify what their journey is like towards ovulation. And so once ovulation has happened, I love that you've already kind of started speaking into the production of progesterone. And for those listening, so Eilish just spoke into the development of the corpus luteum. So what happens after the follicle releases its egg, the follicle then becomes something called the corpus luteum, hence the luteal phase of the cycle. And that then begins starting the production of progesterone. So generally speaking, if there's a successful pregnancy and there's an implantation, that corpus luteum will continue to keep producing progesterone up until the placenta takes over. And that can be into the early stages of pregnancy, midway through the first trimester. And we see changes as the corpus luteum starts to recede in its production of progesterone in around kind of 5 to 7 kind of weeks of early pregnancy. But generally speaking, what I tend to find is this lovely surge in the progesterone. So can you talk a little bit about this luteal phase when the corpus luteum is active and you've released your little egg?
Yeah. Look, it's such a lovely little visual. My course has all these little visuals. I have a smiley face for an egg because I really want to focus. I'm such a visual learner, so but yes, I can talk about it. So after your egg is released, like you mentioned, and a new gland is formed from that ruptured follicle. So it's really important to keep those two things together. Your corpus luteum is formed from that follicle that housed your egg, essentially. So when we're looking at the quality of the corpus luteum, it tells us about the quality of your follicle that ruptured. So after you ovulate and that gland is formed, we ideally want to see it secreting progesterone for like minimum 10 days, but ideally more like 12 to 14. And that's to give your body exposure to progesterone, which is being secreted from that corpus luteum. And we can identify your luteal phase length. If it's shorter than 10 days, it straight away indicates low progesterone, like it's a strong indicator for low progesterone. So let's say we identify your ovulatory event by identifying peak day, which is the last day of any mucus that is either clear, slippery, or stretchy, or you just feel wet or slippery. After that, everything will dry up from a mucus perspective, because when progesterone is secreted, it acts on your cervix to produce a mucus barrier that's so thick and dense that it stays up there and you don't see it and you don't feel it. So that dry up after ovulation, if it's shorter than 10 days, straight off, it's indicating low progesterone.
Okay. That's really interesting. And so generally speaking, we do blood tests again on the peak plus 7 days. So like you were saying, if you can identify your peak day with all these beautiful tools and really paying attention to your mucus, or you've had an ultrasound that identifies the day of ovulation, 7 days later, we do tests. Now, through restorative reproductive medicine, we do hormonal tests that aren't necessarily done as standard by other practitioners, but they're so important to look at all of the hormones. So can you speak into a little bit about what we're looking at 7 days after the peak?
Yeah, so again, from that corpus luteum, we want to know how it's performing. We want to know how much progesterone and how much estrogen is being produced. So we'll test it when we are at peak plus 7 to see if those two hormones are at optimal ranges. And like you said there, not this isn't commonly known. Most people just do that standardized 21-day progesterone test. Now, if you ovulate on day 20, tell me what is the point in testing 1 day later and expecting to see optimal progesterone?
Yeah.
It's just not going to happen. And that woman is going to be told she's got low progesterone or she's not ovulating. And that's just in the test that was timed wrong. It's no fault of that woman.
Yeah. And similarly, like for some women that come through, they might ovulate on day 8 or 9. We've seen really early ovulations. And if they're getting the day 21 test done, that is wildly inaccurate for their cycle as well.
Yeah, they'll be probably at their next menstruation by that day.
Exactly. And I've seen this. People are booking in for their day 21 bloods and they're already, they're getting their bleed the day before. And,
Yeah.
so I just want to, I'd love for you to just kind of speak into the importance of the luteal phase. How long should that be? What should we be seeing during that phase? And because this is such an important part of the menstrual cycle, isn't it?
It's absolutely crucial. It's so important to not kind of overlook. So the length of it, like earlier on I said, between 10 and 16 days, but realistically we're looking between a minimum of 12 days, okay, that we'd like to see it at. And that's to give that brain, to allow your body to be exposed to progesterone, which is such a lovely calming hormone. Um, so we want to see it to be that length. And again, ideally we don't want to be seeing premenstrual spotting, because that indicates that endometrial lining, because progesterone maintains your endometrial lining, whereas if we don't have enough, we might start to see kind of that bit of spotting premenstrually. And if we're seeing that for multiple days and we're pairing that with a short luteal phase, I'd almost wouldn't even need to be suggesting for peak plus sevens, because I'd be so confident that it's suboptimal anyway.
Yeah. And I suppose at this stage, it's probably really important to talk about the different stages of when fertilization occurs and implantation occurs, because the reason why the luteal phase is so important is because, after ovulation, you're not going to get implantation for many days
Yeah.
later. So if your endometrial lining is starting to break down, and this can be a byproduct of having low progesterone, although you could have achieved conception,
Mm.
that endometrial lining isn't going to be able to sustain the implantation and the development of an early pregnancy if it's already starting to come away. So can you talk a little bit about kind of after ovulation, when does fertilization occur? What happens,
Yeah, so after ovulation, the little egg will be, swept into the or into the fallopian tube, and it generally happens in the outer core of the fallopian tube, and then it has to go on its little journey to the womb and implant. Now, generally, this can happen between 6 to 9 days post ovulation, but now it was found in some research for a very small number of women that it occurred on day 11 or 12. So, if you don't have a sufficient luteal phase length, if your endometrium is starting to break down on day 10, sure, there's no opportunity for it to
Yeah.
reach the womb. So optimizing that luteal phase length is so important for everybody. And again, the two hormones, estrogen and progesterone, build that endometrium to make it nice and kind of, let's say, fluffy, and then maintain it. So those secretory glands that are stimulated from progesterone, the progesterone gives that endometrial lining what it needs to be sustained. So those hormones together are so crucial.
I love that. And this is it's so important. I love that you're speaking into this with regard to, this little embryo isn't going to implant straight away. And like Eilish was saying, it can be many days, like coming up on a week and a half after ovulation event before you get the implantation. So it's so important that the luteal phase is exactly where we want it, and that you're getting adequate progesterone production. And to be honest with you, this is probably one of the most common things that I tend to see in practice is having a short luteal phase. And, like Eilish was saying, we're doing bloods, peak plus 7 days after your peak day, your ovulation day. We're looking at estrogen, we're looking at progesterone. And, the reason that we do estrogen and progesterone, you can see the quality of the ovulation and whether we actually need to be supporting the follicle to improve follicle quality and its growth, but also is there support needed for this luteal phase to support a pregnancy that may arise from that. And so, on a journey helping your clients, if you've started to get them to really pay attention to things, how do you work with them then to kind of improve the different stages of the cycle?
So generally, I work with restorative reproductive doctors, and the plan is really individual. So there's usually a really gentle approach to see if we can bring the cycles back into balance,
Mm.
and that will be throughout diet and lifestyle, supplements initially, because a lot of people might overlook the fact that stress is a huge player in knocking off the menstrual cycle. like you really need to take care of yourself on so many more levels than just taking medication or supplements. You know, really minding yourself, really just being who you are, being true to yourself and allowing yourself to just be. And also like getting outside as much as you can and nourishing your body with whole foods. They're all really important things that we consider as well. And then, you know, we started like we do start seeing nice kind of improvements then. If there is a time then when medication is needed, that's absolutely implemented. So there will be follicle supporting medications and luteal supporting medications involved. The plans are really, really individual depending on what that cycle chart is showing. So we have the fertility chart, which will present any issue. So if I'm looking at a fertility chart and I'm seeing, say, multiple days of brown bleeding, that might indicate a low grade endometrial infection. So that warrants a specific treatment to target that. So your fertility chart is like so, so crucial to this journey.
Yeah. And so a lot of women come through and they're like, oh, well, I'm tracking it in my Flow app. I'm doing it here, there, and everywhere. When you talk about fertility charting, are there specific apps that you use that you prefer to see women coming through with because there's more detail? Or what would you generally recommend that people can access and start actually really taking a deep dive with regard to their cycle?
Yeah, of course. So I use and I recommend the Chart Neo app. It is a really superior app for tracking mucus. So again, if you're if you're tracking your cycle with an app that does not count mucus, it's literally missing the foundation of the charting. And the mucus observations on the Chart Neo app are extremely in depth. So we don't miss anything because limited mucus patterns indicate a hormonal imbalance also.
Yeah.
So remember, the mucus is coming from the follicle. Just keep
Yes.
that in mind. It's not just, okay, I'm just going off to observe mucus because that's when I'm ovulating. Where is it coming from? Why are you getting it? What's happening at an ovarian level?
I
You
love
know, it's
this.
really
Yeah.
important.
Well, it's all root cause kind of stuff, you
Mm,
know. I absolutely love. I love that we're kind of really taking a nitty gritty deep dive into this,
yeah,
and just keeping in mind, not everybody can use a Chart Neo app. So obviously,
yeah.
Eilish is specialised in this, and you know, just being able to train your eye to look at these things. So there's a couple of restorative reproductive medicine doctors like myself, that can be able to support women on this journey. But I highly, highly recommend if you are starting out on this journey that you can touch base with Eilish and start to learn the basics of how we may be able to improve your cycle. Even before we go on to medicines, people don't realize that actually once some people that just identify when they might be ovulating or whether there's any tweaks needed here and there. That is all the difference after months and months of trying. And, you know, I've seen so many people end up going down the IVF path that didn't need that, you know, that didn't need it.
I couldn't agree more. And when you're speaking about this, I had a lovely, lovely wake up message yesterday with a positive pregnancy test. It was a timing issue. That's it.
Mm.
Just a timing issue. It's this thing of you ovulate on day 14, you use those days for intercourse. We identified that was not the case.
Mm.
Then when we implemented the true fertile window, that was used, and I woke up to that gorgeous message.
I love
You
that.
know, so
And
and it's so simple, but I promise you, it's so so effective when you know
oh,
your body.
I love that. And I had a similar one yesterday. It was actually a male factor contribution with
Yeah,
regard to testosterone related issues. And once we
yeah,
actually spoke about that and corrected it, the pregnancy the following cycle, and they'd been trying for over a year. So there's a lot to be said for this type of work, you know. And is
mhm.
there any way that people can work with you? How do people find you? How do people reach out?
Yeah, of course. So my website is womensnaturopath.com. And I only have one social media, and that's just my Instagram, which is also Women's Natural Path. So you can find me on either of those, and you can work alongside. I'd be happy to always work alongside women and couples and just support them, and allow them to take the control of their health and their fertility into their hands.
Oh, I love this. Yes, I absolutely agree with this, because that's the thing. Sometimes people feel very powerless when they're seeing the GP, but they don't have any answers or direction. And similarly through the clinics, you get in and you're ferried through a certain path
Yeah.
of the way you need to go. There's no autonomy or feel like that there's a lot of powerlessness in that.
Yeah.
So we'll include Eilish's details in the show notes. Absolutely reach out. Eilish, I have to say, your Instagram posts are so informative. They are absolutely incredible. So for anybody who hasn't checked out Eilish's Instagram, Women's Natural Path, absolutely do that. And if you've any questions, please reach out to Eilish or I, and we can support you on your journey to optimum reproductive success. So thank you so much for joining me, Eilish. I'm so grateful. It's been such a beautiful chat.
Yeah, I really had. I enjoyed that conversation so much, and I'm so happy to have been here. Thank you.
Thank you, Eilish. I'll see you soon. Bye bye.
Take care.